Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy-to-understand concepts. Have you or someone you know started an SSRI and ended up with nausea, diarrhea, or just a weirdly upset stomach? You're not alone. In this video, let's break down why SSRI cause gastrointestinal side effects and how it all comes back to serotonin. SSRI, or selective serotonin reuptake inhibitors, are a widely prescribed class of antidepressants. They're commonly used to treat depression, anxiety, OCD, and other mood disorders. Popular examples include fluoxetine, Sertraline, citalopram, and escitalopram. In depression, SSRIs help increase serotonin levels in the brain. Serotonin is a crucial hormone and neurotransmitter in the human body, helping to regulate appetite, mood, social behavior, sleep, and relevant to today's topic, digestion. SSRIs work by inhibiting the serotonin transporter on serotonergic neurons in the brain's raphe nuclei. This prevents serotonin reuptake into presynaptic neurons, increasing its levels in the synaptic cleft, which helps relieve depressive symptoms. But here's the twist. About 90 to 95% of the body's serotonin is actually found in the gastrointestinal tract, not the brain. Specifically, it's made by enterochromaffin cells lining your intestinal wall. In the GI tract, serotonin plays a major role in gut motility, the rhythmic contraction of smooth muscles that moves food along your digestive tract. When you take an SSRI, you're not just increasing serotonin in your brain. SSRIs raise serotonin levels everywhere, including your gut. There are multiple serotonin receptor subtypes in the gut. But two key players when it comes to SSRI-induced GI effects are the 5-HT3 and 5-HT4 receptors. More serotonin in the gut can lead to overactivation of 5-HT3 receptors. These receptors are found on vagal afferent neurons lining the GI tract. These neurons are part of a sensory pathway that sends signals from the gut to the brainstem, specifically to a relay hub called the nucleus tractus solitarius, or NTS, located in the medulla. The NTS acts like a central switchboard, collecting input from the vagus nerve and other sources, including the inner ear and the bloodstream. It then sends signals onward to the vomiting center, a network of neurons in the medulla that coordinates the physical act of vomiting. So, when 5-HT3 receptors in the gut are overstimulated, the vagus nerve activates the NTS, which in turn activates the vomiting center. This results in a coordinated reflex that can include nausea, retching, and vomiting. At the same time, 5-HT4 receptor activation plays a key role in enhancing peristalsis, the wave-like muscle contractions that propel food through the digestive tract. These receptors are located on enteric neurons within the myenteric plexus, part of the enteric nervous system, often referred to as the second brain of the gut. When serotonin levels rise, as they do with SSRI treatment, stimulation of 5-HT4 receptors increases the release of acetylcholine, a neurotransmitter that promotes smooth muscle contraction. This leads to faster intestinal transit, meaning food moves more quickly through the GI tract, which can result in cramping, bloating, or diarrhea, especially during the early days of SSRI therapy. Here's the good news. For many people, these GI side effects are temporary. Over time, the gut receptors desensitize to the elevated serotonin levels. In other words, the receptors adapt, and the symptoms often fade within a few days to a couple of weeks. That's why doctors usually recommend starting with a low dose and gradually increasing it, to help minimize these early side effects and improve adherence. To sum it all up, SSRIs increase serotonin not only in the brain, but also in the gut. This can overstimulate 5-HT3 and 5-HT4 receptors, causing nausea, cramping, and diarrhea, especially early in the treatment. While these effects are usually transient, they can significantly affect patient comfort and adherence. In some cases, they may lead to noncompliance, especially if the patient isn't warned ahead of time or isn't offered dose titration strategies. Understanding this gut-brain link helps us support patients better, and reminds us just how interconnected the two systems really are. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.